Excoriation disorder, commonly known as skin picking disorder or dermatillomania, represents a complex and often misunderstood condition that affects millions of individuals worldwide. This disorder belongs to the category of body-focused repetitive behaviors and is classified within the obsessive-compulsive and related disorders spectrum in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The condition is characterized by the recurrent and compulsive picking at one's own skin, resulting in significant tissue damage, emotional distress, and functional impairment that can profoundly impact an individual's quality of life. The manifestation of excoriation disorder varies considerably among individuals, but the core feature remains consistent: the inability to resist the urge to pick at the skin despite knowing the potential consequences. People with this condition typically target areas such as the face, arms, hands, cuticles, back, and legs, often focusing on perceived imperfections, blemishes, scabs, or areas of dry skin. The picking behavior can range from brief episodes lasting minutes to prolonged sessions that may continue for hours, during which individuals may enter a dissociative-like state where they lose awareness of time and the extent of damage being inflicted. The etiology of excoriation disorder is multifaceted, involving a complex interplay of genetic, neurobiological, psychological, and environmental factors. Research suggests that individuals with a family history of obsessive-compulsive disorder, anxiety disorders, or other body-focused repetitive behaviors may be at increased risk of developing the condition. Neuroimaging studies have revealed abnormalities in brain regions associated with impulse control, emotional regulation, and sensory processing, particularly in areas such as the anterior cingulate cortex and orbitofrontal cortex. These neurobiological differences may contribute to the difficulty individuals experience in resisting the urge to pick at their skin. Psychological factors play a crucial role in the development and maintenance of excoriation disorder. Many individuals report that skin picking serves as a way to regulate emotions, particularly during periods of stress, anxiety, boredom, or tension. The behavior may provide temporary relief from negative emotions or serve as a form of self-soothing, creating a cyclical pattern where the individual becomes increasingly dependent on the behavior to manage emotional states. Additionally, perfectionistic tendencies and body image concerns may contribute to the disorder, as individuals may pick at perceived flaws or imperfections in an attempt to achieve smooth, perfect skin. The clinical presentation of excoriation disorder extends beyond the physical act of skin picking to encompass a range of associated symptoms and complications. Individuals with this condition often experience significant shame, guilt, and embarrassment about their behavior and its visible consequences. The resulting skin lesions, scarring, and tissue damage can lead to social withdrawal, avoidance of activities that might expose the affected areas, and impaired functioning in work, school, or interpersonal relationships. Many individuals go to great lengths to conceal their skin damage through makeup, clothing, or avoidance of certain situations, which can further contribute to feelings of isolation and distress. The physical consequences of excoriation disorder can be severe and long-lasting. Repeated picking can lead to chronic wounds, bacterial infections, permanent scarring, and tissue damage that may require medical intervention. In some cases, individuals may cause such extensive damage that surgical repair becomes necessary. The risk of infection is particularly concerning, as open wounds provide entry points for bacteria, potentially leading to cellulitis or other serious complications. Additionally, the constant manipulation of the skin can result in hyperpigmentation, keloid formation, and other dermatological complications that may persist long after the picking behavior has ceased. Diagnosis of excoriation disorder requires careful assessment by mental health professionals who understand the nuances of body-focused repetitive behaviors. The diagnostic criteria include recurrent skin picking resulting in skin lesions, repeated attempts to decrease or stop the behavior, and clinically significant distress or impairment in functioning. It is important to distinguish excoriation disorder from other conditions that may involve skin manipulation, such as dermatological conditions, substance use disorders, or other mental health conditions. A comprehensive evaluation should include assessment of the frequency, duration, and triggers of the picking behavior, as well as the impact on daily functioning and quality of life. Treatment approaches for excoriation disorder typically involve a combination of psychotherapeutic interventions, behavioral strategies, and in some cases, pharmacological treatments. Cognitive behavioral therapy has shown particular promise in addressing the condition, helping individuals identify triggers, develop alternative coping strategies, and modify maladaptive thought patterns associated with the behavior. Acceptance and commitment therapy and dialectical behavior therapy have also demonstrated effectiveness in helping individuals develop mindfulness skills and emotional regulation techniques that can reduce the urge to pick. Behavioral interventions play a crucial role in treatment, focusing on increasing awareness of the picking behavior and implementing strategies to interrupt the cycle. These may include habit reversal training, stimulus control techniques, and the development of competing responses that make picking more difficult or less likely to occur. Simple modifications such as keeping fingernails short, wearing gloves, or using fidget tools can help reduce the ability to pick effectively. Additionally, identifying and modifying environmental triggers, such as mirrors, lighting, or specific locations where picking commonly occurs, can be beneficial. The role of family and social support in recovery from excoriation disorder cannot be overstated. Education about the condition helps family members understand that skin picking is not a choice or a habit that can be easily stopped through willpower alone. Supportive family members can assist in creating an environment that reduces triggers and encourages healthy coping strategies. Support groups, both in person and online, provide individuals with opportunities to connect with others who understand their struggles and share strategies for managing the condition. Prevention and early intervention strategies are important considerations in addressing excoriation disorder. Increasing awareness about body-focused repetitive behaviors among healthcare providers, educators, and the general public can help identify individuals at risk and facilitate early intervention. Teaching healthy coping skills, stress management techniques, and emotional regulation strategies during childhood and adolescence may help prevent the development of problematic picking behaviors. Additionally, addressing underlying mental health conditions such as anxiety or depression may reduce the risk of developing excoriation disorder. The prognosis for individuals with excoriation disorder varies depending on factors such as the severity of the condition, the presence of co-occurring mental health conditions, and the individual's motivation and engagement in treatment. With appropriate intervention, many individuals can achieve significant improvement in their symptoms and quality of life. However, recovery is often a gradual process that requires ongoing commitment and support. Some individuals may experience periods of improvement followed by relapse, particularly during times of stress or life transitions. Research into excoriation disorder continues to evolve, with ongoing studies examining the underlying neurobiology, genetic factors, and treatment approaches. Advances in neuroimaging technology and genetic research may provide new insights into the mechanisms underlying the condition and lead to more targeted and effective treatments. Additionally, the development of smartphone applications and digital therapeutics offers new possibilities for delivering interventions and providing support to individuals with excoriation disorder. In conclusion, excoriation disorder represents a serious mental health condition that requires understanding, compassion, and evidence-based treatment approaches. By recognizing the complex nature of this disorder and providing comprehensive care that addresses both the behavioral and emotional aspects of the condition, healthcare providers can help individuals achieve meaningful recovery and improved quality of life. Continued research, education, and advocacy efforts are essential to reduce stigma, improve access to treatment, and support those affected by this challenging condition.